Okay, Bismillah Rahman Rahim. We're going to talk about today CTG or electronic fetal heart monitoring. It's one of the important lab we cover extensively in the lab for maternity courses, but here we're going to talk about it very quickly. It's just a quick recap for you, student. CTG, as we know, it's a procedure that can be done to monitor the fetal well-being, and also it can tell us a little bit more about the uterine contraction activity. It's mostly done during labor and delivery, either continuously or intermittently, but also we can do it to monitor the fetal well-being during pregnancy, as we talked about NST, non-stress test, and other tests. And we're going to talk about first the trace itself to review it really quickly. So in the trace here, we have this part. This part is for the fetal heart monitoring, and this part, the lower segment, is for the uterine contraction activity. And we're going to focus today only in the upper segment, which is for the fetal heart rate. And as you can see here, you have like many squares and numbers. So what does that mean? So let's divide the trace to the vertical axis and the horizontal axis. The vertical axis represent the amplitude of the fetal heart rate, which I'm talking about the strength. Like one of the heart rates, like for example, the beats will be 140, the next one will be like 120, 100. So it presents the amplitude, القوة of each, the strength of each beat. So and you can see there are numbers 60, 80, 100, which is mean like between each line and line, like 60, 70, then 80, 90, 100, and so on. So how about the verticals? At the horizontal line, it represents the time. Okay, and as you can see, there are small squares. So each small square, this here, this guy, each small square equal 30 seconds. So which means that two small squares equals to 60 seconds. Excellent, which is 1 minute. So you have to know these essential element before we dig deep in the interpretation, the electronic fetal monitoring for the purpose for this video. So we're going to talk now about what part we're looking at in the CTG to evaluate the fetal heart rate. We'll start with baseline, and then variability, acceleration, and deceleration. Let's talk about them very quick. So the baseline, it's a baseline. Like we want to take the baseline for the patient vital signs. We want to know the average heart rate, the average of the vital signs of this patient. The same thing, the average heart rate for this baby. Okay, and it has to be within at least 10 minutes windows. Okay, so how does that work? So I always tell my student, if you want to know the baseline of your baby, just draw an imaginary line. This imaginary line has to go through most of the reading of the fetal heart rate, and if you can see, most of the beats, the average, most of the baby's beats here is around 120, which is normal, because the normal fetal heart rate is range from 120 to 160 beats per minute. So we can say the baseline is 120 here, and we are happy about it. Let's move to another example here. Another example here, if you can see here, the fetal heart rate is like here 120, 180. It's about, the reading can tell you maybe around 200. And we said the normal range of fetal heart rates range from 120 to 160, which mean here the baby is having over that range. It could be here, if I can see it, I think around 200, which is tachycardia. That means this baby is not doing good. Or let's say, we cannot say that actually just blindly, which it means that we are having abnormal reading. Just we call it tachycardia for now. Okay, so fetal bradycardia, which is the opposite. So if you can see here, If you draw a baseline, imaginary baseline here, it was 180. And then this is, it went even lower to, I'm sorry, it was 80, and now it's like 60. And we said again the normal range from 120 to 160, which means the baby here is having a bradycardia. Not only bradycardia, but he's also having minimum variability, which we don't like it, and we're going to talk about variability as well later on. So here also minimum variability, and definitely it's not reassuring sign. Okay, so the variability, what's variability? From its name, variability is the changing of the fetal heart rate, changing, which means that one of the fetal heart rate could be, for example, 100. Okay, the next one might be 80, then it goes up to maybe 120, then let's say 90. Then each beat, if you can see, has different strength. The reading is changing ups and down. So the variability actually is a good sign to have moderate variability when the changes range between 60 beat to 25 beats. We like to see this. This is a reassuring sign. That means the baby is, the condition, the well-being of the baby is reassuring, and it's indicating there is a balance between the sympathetic and parasympathetic, between the nervous system and the cardiac beats, the heartbeats. So this is good. But we have the minimum variability, as we explained in the previous example. So when the changing in the fetal heart rates are really minimum, we don't like to see that. We love to see moderate variability. Marked variability, when the changes in the fetal heart rates, like it's like over 25 beats per minute each change. You can see ups and down, within like 25 beats or more. Again, we're going to revisit the examples that we talked about. We said minimum variability in the previous trace. You remember that? Yes, here. This is minimum variability. We don't like to see it. Minimum variability. We don't like to see it. Sometimes the baby might be just asleep. You just need to wake up the baby, change the maternal position, give her water to drink if that is allowed, cold water. It might stimulate the baby and change the variability a little bit. And with the acceleration, we're going to talk about acceleration as well later. Like here, this is a moderate variability. If you can see the changes between the fetal heart rates between 5 to 25, which is what we like to see. Usually in real life, we don't count the changing between each beats, but with experience and with the consultation of your colleague, nurses, the doctor, the midwife, you can just evaluate that by the way it looks, because it's become very easy to identify the minimum variability with the marked variability. Again, this is another example of moderate variability, what we consider normal. This is actually, and also you can see this is reduced variability. It can be also called another name. This is not the scope of this video. This video only want to show you the basic of electronic fetal monitoring. This is minimum variability, and also can be called other terms. Here, okay, we're going to talk about something we called periodic changes. The periodic changes, one of them is acceleration, which means it doesn't happen all the time, and you can see the changes on the ACG trace itself. So acceleration mean increasing on the fetal heart rate. Okay, and remember the rule is 15 times 15. Remember this rule, never forget that rule. What does that mean? It means that when we want to evaluate for acceleration, we look at the increase in the fetal heart rate here. So we said increasing the fetal heart rate, this is what we consider acceleration, and this is another acceleration, and this is another acceleration. As we said, it's increasing in the fetal heart rate, but we said also the rule is 15 times 15, which means, okay, if you see the baseline here, most of the reading, the fetal heart rate is about 120. Is that right? So this is the baseline. And here, when you see increase of the fetal heart rate from the baseline, it was 120 and it reached all the way to 145. So it increased more than 15 beats. So we're talking about the strength. And it not only that, if you can see the increasing lasts for a few times here. It was a little bit, it was up here for a while. Here again. See? It was increasing for a while. Here again. And this is the second term of the rule, which is the time. The second 15 stand for time, which means the fetal heart rate increased for at least 15 seconds. So look at this one. We mentioned before the small square equal to 30 seconds. Here, if you can see that, it increased one small square, second small square, 15 plus 15, it increased for about 1 minute. So the strength of the beat increased more than 15 beats, the strength, and also the duration, it lasts. It took a while for the acceleration. It was high until the 40 for about 1 minute. The same here, two small square, about 1 minute. So it has to increase at least 15 in the strength, and it has to stay on that increased limit for at least 15 seconds. Okay, I hope it's clear by now. Maybe we have here another example. Maybe we have more example. But for now, we're gonna talk about deceleration. When we talk about deceleration, remember deceleration from decrease. So it means that there is a decrease on the fetal heart rate from the baseline. And also remember that we have the rule 15 times 15. It's also applicable in the deceleration, but it has the opposite meaning. Let's talk about this in detail with an example to make it clear for you. Here. So we have different types of deceleration. We're going to explain each one of them. We will start with early deceleration. So deceleration, we said that it's decreasing on the fetal heart rate, okay? But also we have type of it. So if you look at here, if I told you which part of the fetal heart rate on the tray is here, that you can tell you, wallahi, there is a decrease in the fetal heart rate. If we say this is the baseline, if we draw an imaginary line, as we said, also the baseline is about 120, which is normal. But also if you notice here, there is a decrease on the fetal heart rate. Again, decrease in the fetal heart rate. And how much it decreased? If we said the baseline was 120, generally, it reached all the way to 90. So that's a big difference, about, I think, 30 or more. So decrease, you see the difference is more than 15, which is the main, the first part of the rule. 15, it decreased in the strength. And then if you notice, it stays down there for a while. So here at the 90, it talk about 30 seconds sitting there on the low edge. Again here, it decreased from 120 and it went all the way back to 100. The difference is 20, so it's more than 15. And then it stays there for about 1 minute, which is 60 seconds. So the rule said 15 times 15, and here each deceleration happened for about 30 seconds to 1 minute. So definitely we can call this deceleration. But the question is that, why do we call it early deceleration? So when we talk about the type of the deceleration, we have to talk about the uterine contraction. If you can see, this is one uterine contraction as we explained in the lab. And this one shows another uterine contraction, another uterine contraction, another one, and another one. If you can see, the uterine contraction here, when it starts, the fetal heart rate decrease. Again, when the uterine here about to start, if you go down, here, the fetal heart rate decrease. So we call it early because it happened with the uterine contraction. We call it early because it happened during the uterine contraction. Again, if you can see here, we call it sometimes the mirror deceleration because it's like the opposite shape of the uterine contraction. Here, the deceleration happened with the uterine contraction. Similarly here. Okay. Let's move to the second. Hopefully we have an example or a second definition. Let me see what we have here. And let's go down a little bit here. Okay, so we're going to talk about late deceleration. Late deceleration. So late deceleration, like at the beginning, what is the deceleration? It's obvious. One is here and one is here. And the baseline is again about around, I think, 120. Okay, and this is a uterine contraction happen. Another uterine contraction happened. This one happened too, and this is another contraction. But if you see the relationship between the deceleration, the decreasing in the fetal heart rate, with the uterine contraction, you can see that after the peak of the uterine contraction, the decrease of the fetal heart rate happened. Again, this is the peak of the uterine contraction, it reached. Then after the peak of the uterine contraction, the deceleration happened. And if you can see, if I delete my marks on the screen, you can see that. See? It's very obvious. If you draw a line, and I'm going to do that now. Here, look at this one. The uterine contraction came, the deceleration came after uterine contraction. Again, the uterine contraction came, then the deceleration happened. So we call this late uterine contraction. Usually, it might indicate of something we call fetal-maternal insufficiency. There is a problem with the fetal-maternal circulation, and in this case, and also in the early deceleration, we turn the mother position, or we turn the left lateral position. We like that. In this case here, we might give her oxygen. We inform the senior, could be a nurse, midwife, doctor, about what's going on. Sometimes they might increase IV fluid if it's possible, based on the patient condition. If we can increase the fetal, the IV fluid rates, it might help. Stimulation a little bit might help, but we have to rule out any other pathological causes in this case, especially in the late deceleration. And if it stays for a long time without good recovery, we have to definitely monitor the mom and the baby closely. And here, this is another late uterine contraction. If you can see late, and then after the peak, the fetal heart rate start to decrease. Again, after the peak, the fetal heart rate start to decrease. So this is late uterine contraction. Not only late, but also prolonged late uterine contraction, which is talk about this is 1 minute, 2 minutes, 3 minutes. This one took 1 minute, 2 minutes, 3 minutes, almost 4 minutes. So this is prolonged because it took longer time, and also late uterine contraction. And if you can see, the minimum or the variability of the baby is within considered minimum variability, and we definitely we don't like to see this changes in labor and delivery. We'll do our best to take care of for the baby and the mother. Okay, so the variable uterine contraction, variable deceleration. The variable deceleration, you can see it from its name, variable. It doesn't follow any rules. It happens under different circumstances, not necessarily related to uterine contraction. What does that mean? So let me explain that. Let us see a picture here. And here, let's look at this picture. Example. So we have it here. If you can see this one, let me delete this so it won't confuse you. I can delete it for some reason. I don't know why. Okay, so here. Okay, it's from the trace itself, from the picture itself. So if you see here, this is the uterine contraction, which is abrupt. If you can see the decrease here, abrupt, suddenly decrease. You see again, abrupt decreasing. Sudden decrease in the fetal heart rate. This is what make the variable one of the feature of the deceleration. You have abrupt decrease in the fetal heart rate. And also, if you can see this one, we might say, okay, this might be an early uterine contraction, but what happened to this guy here? What happened to this deceleration? There is no uterine contraction to associate it with. You might say, maybe this is early, maybe this is late, but there is only one uterine contraction. Again, this, like we have a contraction here, we have a contraction here, and there is a deceleration in the middle. So it has no direct, mostly no direct relationship with the uterine contraction. And you can see there is abrupt decreasing on the fetal heart rate, as I showed you before. Look at the line, decrease right away. See, it's not gradually like the previous one, the early and late deceleration. Most of the time it's abrupt decreasing on the fetal heart rate, and it has no clear relationship with the uterine contraction. So here, if we look at this example, this is another example. You might say, okay, there is a gradual decreasing in the fetal heart rate. Yes, I agree with you. But look at this one. Look at this uterine contraction. You might say, okay, this is early, maybe. What about this one? It comes between two uterine contraction. This one could be early. This one may be early. So if you can see, there is like variable deceleration. Some of them before, some of them after, some of them in between the uterine contraction. So at this time, we call it variable deceleration. Prolonged deceleration, I already talked about it there. So deceleration that lasts 2 minutes. It could be late, it could be early, but any deceleration that lasts for 2 minutes, we call it prolonged uterine contraction. If you can, I'm sorry, prolonged deceleration. So I'm talking so fast, please forgive me. So here, if you can see, this is a contraction, then a decrease in the fetal heart rate, and it took like, look how many minutes? 1 minute, because two small squares. 2 minutes, 3 minutes, 4 minutes, 5 minutes. So as long as it is 2 minutes and more, we call it prolonged uterine contraction. And again, we have to make sure the vital signs is normal, the mother is normal, in the right position, change the position, the type of medication she is taking, and all this assessment that you have to do an intervention in order to make sure the baby and the mother is doing fine, inshallah. So look at this example. Also, you have it here. We just put it in one box. What's the difference between what's acceleration? We said it's an increasing. Remember 15 by 15, the rule. Early deceleration, it has to we have to have actually uterine contraction here, which come once the uterine contraction starts, the deceleration happen. Variable deceleration, we said it has no relationship with the uterine contraction most of the time. And you can see that there is abrupt decreasing in the fetal heart rate, lead deceleration, and we explained that in detail. I think we are reaching the end of our revision. The contraction, we're not going to talk about contraction. I just want you to focus for the purpose for this video on the fetal heart rate. And this is Dr. Sarah Al Khaifi.